All right, why don't we go ahead and get started? I'm sure most of you know who I am, but my name is Tara Catanzano, and I am here today in my role as the Associate Director of Academic Career Development for the Office of Faculty Affairs. And what we're going to talk about today is finding your niche, getting academic output from your day job. And these are my disclosures. So, what we're going to talk about today is a little bit about the definition of scholarship. We're going to identify and capture CV worthy activities. We'll talk about some of the ways that you can convert your everyday activities to academic output, and then we'll look at a few examples. So, whether you are a researcher, a pure clinician, an educator, an innovator, or someone who's very interested in population health, this talk applies to you. All of what I'm going to tell you can apply across the spectrum of people's activities. So, many of you may have become familiar with the term career ladder. And what it means is how do you move on to those next rungs of development, whether it's in your professional day to day activities, if it's into leadership roles, if it's into national prominence. This is called the career ladder. And it involves a whole bunch of different things. I think probably the most important is figuring out what your career focus should be. What you don't want to do is lean your career ladder against the wrong wall. It's only going to get you to where you're going faster, but it may be the wrong place. So, figuring out what your career focus should be is very, very important. You also have to have opportunities for your career. So, you need to figure out where the opportunities are to move up on those rungs. You have to be very engaged in the process of academic career development. It's very easy to kind of let day to day activities push the overarching theme of your career to the side without really focusing on what it is that you're doing that you're passionate about that really could move you up that ladder and can help you to get promoted. So you really have to be engaged and aware of what it is you're doing and how it all ties together. And a lot of that involves scholarship. You should be able to get your work out there and disseminate it so that people are aware that you are an expert in the field and that you're moving up this career ladder. That helps you to develop your reputation, which is clearly very important as you are moving along these ranks. You have to be recognized as an expert in your field. Some of that involves mentorship and sponsorship, which we're unfortunately not going to touch on in this talk, although it is my very favorite subject. And it also involves academic service, which we will touch on a little bit later on. So many of you are probably thinking, oh my God, I'm just really busy working every day, taking care of patients. And what's gotten me to this point so that I can be a full fledged practicing clinician is never going to get me up that ladder. It's not going to get me to those next steps. And I would actually disagree with you. I think that what you're doing every day really can get you to those next steps and get you promoted, and not just promoted, but also get you recognized for what you're doing that is incredible. It's very novel things in a lot of cases, things that are making you an expert, that are really helping patient care and healthcare environment in general. So I think that what you're doing every day really can get you promoted. It's really a question of leveraging your time and your activities so that you can move up those ladders. You're already doing it. So how do you put it all together in a package that will help you to move up that career ladder? So, we're going to spend the next part of the talk defining briefly scholarship, and hopefully, all of you got an opportunity to watch Rebecca's first talk in this series, which was all about scholarship. Is a fantastic talk. The link to it is actually on the OFA website, so please feel free to tune in and watch it again, or if you didn't get an opportunity to watch it at all. From my perspective, scholarship really is the dissemination of your work at the local, regional, or national level. And the key there is dissemination. I know a lot of you are doing really amazing things. You're doing innovations and you're educators and you're scientists and you're taking patient policy and doing amazing things. But if nobody at the institution or beyond knows about it, you're not getting the credit that you're due that can help you to build your reputation and your brand and to really move up that career ladder. So dissemination really is key for this. And I think a lot of us are familiar with the more traditional types of scholarship, which are the peer reviewed publications in the printed journals. The last decade, we kind of moved into some peer reviewed online publications, which were valuable for promotional purposes. And invited presentations were kind of the holy grail. That's how you knew you had arrived if you were invited to present your work at a national meeting. But I would argue that, particularly under UMass's expanded definition of scholarship, there are a whole host of other ways that you can showcase your scholarship. Maybe you're doing policy development here at the institution that you can share beyond the walls of Bay State and become known for that policy. Maybe you're being invited to write editorials for journals. Maybe you're involved in enduring material development for some national committee work. That's scholarship. And that actually is being recognized as important by, at least under the definition that UMass uses. Invited webinars, particularly in this age of COVID, are really great ways to showcase your knowledge, expertise, and all of your gravitas. Media interviews, surprisingly, can be recognized if you are using them in the right buckets and using it to disseminate your expertise and knowledge with a greater good involved. So I would remind you that not all scholarship involves NIH grant and peer-reviewed first author publications. I really highly encourage you to focus on your areas of expertise and to disseminate your knowledge this way. I think if you can marry what you are passionate about and committed to and work to publish those or to get those out there as scholarship, you don't need the NIH grants to be able to establish your reputation as an expert in your field. So that's my quick little summary of scholarship. Again, I would refer you to Rebecca's talk for a really in-depth discussion of it. So let's look now at identifying and capturing CV worthy activities. I'm sure all of you are very, very familiar with UMS's CV template. The purpose of the CV is really to capture all of your accomplishments and to highlight them in such a way that it tells the story of your career and of how you are progressing in your reputation. It is your entree into so very many academic worlds. It's your currency. This is what people are going to look at and understand what your purpose is, what your focus is, what your goals are, and how you have brought forward the success of medicine or moved medicine along to those next levels. It's really important. And you have to make it perfect. You really need to put your activities into the appropriate buckets so that people can understand the story of your career and what your reputation actually means and what your expertise is in. Tie all the information together on the CV template. And I think actually UMass's is really good, even though it's very detailed. It allows you an opportunity to really dig into things that maybe you didn't realize you were doing, and it puts it all in one place so that you can very clearly see your progression. It's also very important, I think, to have peer review. So you may have someone who is doing very similar activities, either in the institution or outside, who has worked with you, and they are aware of a lot of the things that you're doing. And maybe you don't recognize that they are actually worthy of putting on your CV, but your peer might. Or you might actually look at your peer's CV and say, oh my gosh, I did that too. I didn't even think to put that on my CV. So I think that that is a really helpful way to sort of do an internal check to say, okay, am I capturing everything that I should be? And then a gap analysis is really important. And I want to spend 1 second on this. Many of you are familiar with this. This is our CV template from UMass. And I think that there are two reasons to pull out this template periodically, say every, 3 to 6 months. One is to kind of look at the different areas under the buckets and say, you know what? I'm not doing any of this. So I should really focus some of my activities in this upcoming year on doing more of this because I don't have enough to start building my reputation out in that area. So it can really help you be as a guide to plan your next level of activities. And you can do that for, 6 months, a year, 2 years out. You don't ever want to do it right before you're thinking of going up for promotion because that's not enough time to be able to fill in all those gaps. The other reason I think it's important to do this is that the last time you updated your CV, you may not have been doing some of the things that you're doing now, and you may not recognize that these are actually CV worthy. So if you deleted that header when you were putting your CV together, you may not remember that UMass actually values that as CV worthy or as scholarship, and you may forget to put it back in. So I think it's really helpful to pull these things out every 6 months to a year and really look at them critically. Because how many of us have done this? I gave a lecture, I wrote a curriculum, I mentored a medical student on a project, I did whatever, and then plumb forgot to write it down. Any of you know who this is? So this is Steve Urkel, who was from Family Matters, and he was famous for saying, "Did I do that?" You would be shocked at how many times you have done something that is worthy of putting on your CV and simply forgotten. I will guarantee you that a week from now, when I have to give my next lecture for a society that I'm giving a talk for, I will not remember this talk and that I gave it and on what date because something else has detracted my attention from it. So, really important to write it down. And I think that this involves two things. One is recognizing that it is CV worthy, and the other is recording it. So if you don't recognize that it is actually something you should put on your CV, you're never going to think to write it down, are you? So this is something we really need to train ourselves, particularly with the expanded definition of scholarship that many institutions are using. It is not just those NIH funded grants, it is not just those peer reviewed articles. It is things like curriculum development, patient education materials, policy and protocol development, quality and safety activities, community outreach, and media activities. And I'm going to give you guys a QR code, and I'm going to spend a second here so you guys can do this. And this links to the metrics that UMass uses for each of the different areas of distinction and at different levels of rank. So you will see things that are expected for promotion to the rank of assistant professor. You will see things in, healthcare delivery or education for promotion to associate. So I think that this is very useful to look at to get an idea of what maybe you need to strive for as a goal for those next levels. And then you have to remember to write it down. So you can do this any which way you please. You just have to do it. You can stick it in the notes function on your phone. You can use the Google Suite to have a record of it any place you go, as long as you can get internet access. You could put it on a Word document. You could use the old fashioned pen and paper and write it down. You just have to remember where you put that piece of paper. I actually have started using something called Google Keeps, and I really like this because what you can do is use this note-taking app to continually add to different things. So you can see I've got a whole bunch of different stuff that I do, and I can add, invited talks as I go along and always have them. One thing you'll notice that I didn't do here that's bad on me, put the dates because you won't remember what year you gave it in, I guarantee it. So make sure you put the dates that you did this. But what's really nice is that I could click and drag this anywhere I want to in this setup. And that helps me to strategize and say, okay, I am doing way too much of this. I'm not doing enough of this. And I can reprioritize for myself what I should be focusing my attention on and what I should maybe think about stopping to do. Again, very strategic. And this is a really helpful app to do that. Again, we talked about the CV templates, so you can use the hidden text to make sure that you are putting these activities into the right buckets as you're getting ready to transcribe them from whatever device you've put them on onto the CV template. Make sure that you look at the hidden text so that you know where they should go. And remember that in appropriate settings, you may be able to customize new categories of things that are scholarship that don't really conform to any of the other ones, but highlight your reputation and your expertise and your activities in such a way that maybe they should be included in a new category. That would require some discussion with your chair and the Office of Faculty Affairs to figure out if you can do that, but it's something to think about if you're doing something sort of outside of the box. This will link you to the webpage that hosts our CV template and the narrative statement. So go ahead and scan that so you have it easily accessible. All right, now we're going to look at some ways to convert activity to output. I will just ask you if you all know who this is. I feel very old as I'm putting this together, honestly, because these were from my generation. But we're going to look at the top 5 tips for academic success. And again, this is just my opinion. This is what I personally think are important and I have used in my career to move forward. One of the very important things that we've sort of touched on is aligning your interests and your activities. What is your subspecialty? What is it that you love to do when you come into work that you say, this is the part of my day that I just love the most? It's what I look forward to. Maybe it's this is mammograms for anyone who doesn't know. Maybe it's that you really love being an advocate for women's health. And so you get to do part of advocacy as part of your job. Is there a way that you could align these activities to allow you to do more of that? Or could you use those activities to allow you to do some scholarship around it? So, figuring out what it is in your job that you love and that keeps you going and that makes you be engaged is very important to figure out how you should align your activities. These will also help you build your reputation. So, if you are doing things that you are passionate about, say it is the women's service line, and you are doing things and putting out your scholarship with patient educational materials or presenting novel ideas about how you can get women to come in for their mammography, put it out there. It will help you to build your reputation as someone who is an expert and passionate about this area. But how do you convert this to scholarship? It's great to be passionate about things, and I'm passionate about education and career development, but how do I convert that into something that will actually get me promoted and help me to move up maybe into a different role? Well, that's where the academic output comes out. You can use a whole bunch of different things. Maybe you have developed a protocol for the institution that will help you get these pretty cardiac images. Well, what can you do with that? You could bring it to a national society and say, hey, I've got this great way to do this in a really short time with excellent quality images. Could we put this out there as a society guideline? That's something that you could do already done at your institution. Maybe you're interested in quality and safety projects. Well, you could convert that into a paper. Maybe if you're really passionate about advocacy and patient education, you could create some materials for referring clinicians and for patients, explaining to them a policy or procedure or something that they can expect as they're coming to your clinic or getting treated for a specific disease. That's scholarship as long as you disseminate it beyond the institution. Maybe you want to write a grant about your experience in the neonatal ICU with some new drug. That's also possible. And any of this can be put into a lecture and given at a local, regional, or national meeting. And the more you do this and the more you get comfortable with speaking, the more you'll find that you have opportunities to be invited as a national speaker. It all again comes back down to career focus. And how do you decide what that focus should be? You can decide that your focus is going to be healthcare delivery, which is probably 90% of the people here at the institution. Maybe you're an educator, you're interested in public health, or you just love the right adrenal gland and you want to be an expert in it. This career focus and this passion will really help you to determine what your goals should be and how you should move forward from here. This is not without challenges. And for non radiology friends, here's the right adrenal gland. This little left adrenal gland is the not normal guy in this picture. What do you do if you just don't know what you're interested in? And I think that that's probably something we see most at the early career ranks where, you're super excited, you finished your training and you don't know what to do after that or what should be your defining moment. I think self-reflection really helps with this. Again, think about what is it that gets you really excited to come to work? What do you love to do? What's the part of your day you look forward to? Mentors can really help you with this. If you meet with somebody who provides you with some reflective listening, asks a few questions, gets you to tell them what it is that you like or don't like about things, and then just reflects it back to you, that really can give you a different voice besides the one inside your head that can help you to decide what it is you actually are interested in. And that will help you to inform what you should do from there. And there's nothing wrong with exploring other opportunities. Sometimes you have to dabble in the wrong things to find the right thing. So sometimes doing a little bit of exploring is a good thing to help you figure out what your passion really is. All right, so you found out what your passion is. What do you do if there's already that expert on the right adrenal gland at your institution? Well, you could learn to love the left adrenal gland, even though this one's not very happy. You could leave the institution, or you could ask that expert for some collaboration or some mentorship. And that brings me to my next tip, which is networking and collaboration. So, networking is really beneficial. Not only does it allow you to find other people who are just as passionate about whatever it is that you're passionate about, but it also helps you to promote dissemination of your scholarship. I think that there are some important things that you can do to promote networking. Clearly not necessarily in the era of COVID, but before COVID and hopefully afterwards, attending national meetings will allow you opportunities to network with people who are really truly experts in the field and have established reputations. If they have mentoring sessions, I would really encourage attendance at those because you will not only get some very important pearls, but you will also have an opportunity to find potential sponsors. And as much as people like me who are introverts cringe at it, attending social events and meet and greets really can be the way to make those collaborations happen and to find people who are very like-minded to you. And then sponsorship obviously is very important to help you to get to those next levels for things like being on committees. In the era of COVID and even before that, I think social media has become a fantastic way to start networking. It is a whole new world. For those of you who are not familiar with the symbols, this is Instagram, which is sort of the millennials and Gen Z favorite. Facebook is more of the Gen X, and then Twitter is really kind of everybody and is really the preferred social media networking for the medical profession. I highly recommend you get yourself on one of these, preferably Twitter. There are a lot of benefits to it. It will allow you to network with people inside your institution and outside your institution. And I mean way outside your institution, people across the country and across the world. And it can let you start collaborations. I have written at least one paper with people outside my institution who I didn't know just by putting an idea out there on Twitter and getting a group of people together. It really works. You can also disseminate your scholarship this way. So this is what's called a visual abstract, and you'll see that this person, Del Carmen, put this paper out in JAMA in 2019. And so what they did was they put the information that was included in the paper as highlights in a very eye-catching way so that people will click on this visual abstract on Twitter and it will actually link to that paper. So this has been shown to really increase people being driven to the site where the paper is housed and increasing the number of reads and downloads. So very effective networking and promotion of your scholarship. Social media networking is very helpful for women who, as we know, there's really substantial disparity in the rates of promotion of women in academic medicine. It allows you to brand yourself. Again, for someone like me, it would be I am someone who is passionate about education and career development and leadership development. And so that is my brand, and I stay true to it on social media. And we all know this. Be prudent about what you're putting out there and be very professional. It is in social media forever. So don't put anything out there that you don't want people to see. So let's look about collaboration that may arise from either social media networking or networking elsewhere. It is very helpful to collaborate with others, particularly if you can find and establish an effective team. I have teams of people that I love to write with because we're very like-minded and we all complement each other. Finding somebody who can complement areas that you struggle with can make it much easier to get those papers out there. For instance, I am terrible at lit searches and references, and they just are the bugaboo of my writing. So I collaborate with people who are fantastic at them and can get those done really quickly. So that is the way to find an effective collaborative team. If you're early in your career, what you might want to do is find a research or a publication mentor to collaborate with who can really teach you the ropes of doing this the right way. Remember that right adrenal gland guy? Go find him. Peers and senior faculty with similar interests can also be good collaborators for you, particularly again at the early career stages where you're just learning how to do all of these different activities. And don't forget to look outside your own department or your own specialty. You'd be surprised at how many collaborators you might find in a different arena who have really important things to contribute to your scholarship that are very vital to move the whole practice of medicine forward. Social media and in-person networking can really help you with this. All right, number 3, yes and no, and opportunity. Be strategic when you are saying yes to an opportunity. Does it align with the things that you are passionate about and are already doing in your day-to-day activity? If it does, fantastic. Say yes and go and do it. If it doesn't, can it still be strategic and be in the favor bank? So, for instance, if your chairman asks you to participate in resident recruitment and you really doesn't align with your interests, if you say yes, can you then later remind the chair that this is something that you helped for the greater good when you're asking for something that is in alignment with your career? If that's the case, then say yes. But it's also very strategic to say no. Say no to the wrong opportunities that don't align with your interests and passions and your daily activities. Do so with grace and respect so that nobody is offended when you turn them down. And you may sometimes need to say no to a good opportunity so that you leave room on your plate for a great opportunity. And I know that that sounds really odd, but it's very true. I think as you move through your career and your reputation grows and you become known for being an expert in the field, there are more opportunities that will come through than you can handle, and you just don't have bandwidth for all of them. And so, while something may seem like it does align with your career goals or your strategy, you may say, okay, my bandwidth is kind of limited. And if I do that, that's going to give me less time for this. And so, I may not do as good a job on the thing I really enjoy. So it's okay to say no to those opportunities, and you probably should, so that you really can continue to do the things that you're doing well and not short shift when you are trying to balance so many obligations and opportunities. And then opportunity is also really important. Now, I think early career faculty struggle to say, I'm not being given opportunities. And I think that that is true. You don't have your reputation established. But I would argue that you can always make opportunity. And I am a big fan of this. I think that if you are passionate about something and you see a need or a gap in something, either in your department or at the institution or at the national level, you can make your own opportunity. It's a question of reaching out and finding the right people to connect with. And that can be easier than you think. For instance, I had a conversation with a program director friend of mine, and in the conversation we were talking about, what we're interested in doing in the next phase of our career because we're both at about the same level. And I expressed an interest in doing an MBA because I want to be a department chair at some time. Well, just so happens that his chairman has an MBA and would have exactly the kind of information that I would need to help me make those decisions or to connect me with someone else. So offered to set up a meeting. Never let the sun set on an opportunity. Look around you, see what needs to be done, and then go do it. Don't wait for someone to hand you an opportunity. That's really how you get ahead. All right, academic service. This is one of my favorites because I love academic service. But what does it mean? It is your activity in support of and participation in an academic society. And that can be at the local, national, or regional level. And generally, what it involves is committee work. And there's a slew of different types of societies that you could get involved with. So some of them are specialty specific. So for me, I'm a radiologist. So we have probably a gajillion different societies because there's about 11 subspecialties of radiology. Maybe you are really interested in that women's health advocacy work. There are advocacy groups out there that you could work with to provide them with some academic service. Maybe you're a med ed person. Lots of program director kind of national societies that you could be involved with, or medical student societies. Or if you're a researcher, there are basic science research committees and societies out there that you could really contribute to. So, how do you do it? Again, I would say figure out what your passion is and then go find the committee. Don't just say, "Oh, I want to be involved. I want to get my career moving and I'll sign up for anything." That's not, I don't think, the best way to go about it, because you could end up on a committee, and I have absolutely nothing to do with your interests. I'm on, for example, an economics committee, and I just hate it. So am I going to show up and be my best self? Probably not. But I am passionate about education. So those are the kinds of committees that I should be searching for. Some of the societies have sign up sheets either in person at the annual meetings or in a digital format on their websites. So you can find your favorite academic society and then go look for volunteer opportunities and see if they have a digital sign up sheet. Sponsorship can help you to get on a committee. So, if somebody says, I think that this junior faculty is fantastic in digital media, I really want them to be on this media committee, they can go and talk to the committee head or someone who knows the committee head and really speak for you to help you get on that committee. Some committees are really hard to get on. The larger the society, it seems, the more members, the harder it is to get on a committee because there's more members than there are opportunities. I would just say be persistent. If it's something that you really enjoy and you think you have something to contribute, then go ahead and apply year after year until you finally get on a committee. It is very helpful to know the society staff or the executive director of a national society. You'd be surprised how many people get put on committees because the person making the committee roster is the society members' staff. If they like you and they think that you offer the committee a new perspective or have something to offer, they can put you on there. But once you're on there, you need to show up and contribute. You can't just be someone who is nominally on the committee and never makes a committee meeting, never speaks in a committee, doesn't contribute any ideas or thoughts, doesn't give feedback. You really need to participate. And you'd be really interested to know how many opportunities there can be on these committees for putting out new ideas. They are always looking for something fresh and different that can move the work of the society forward. So really be engaged if you are on these committees. Why does it matter? And how can you leverage it to get promoted? Well, we talked a little bit about brand before. So, being on these committees, again, finding the committee that matches with your interests and activities will help you to build your brand. You can be known as the patient advocacy person, the one who's really interested in making sure that healthcare equity happens. That's your brand, that's who you're known for. It also helps you to build your reputation. So, this is very important as you are looking to those higher levels of promotion where you need letters outside of the institution and outside of the region, particularly for the associate professor and professor levels, where your reputation needs to speak for itself. And you may struggle to find letter writers, particularly as the time for academic work shrinks in all institutions and people are being flooded with requests to write letters for different people. If you're on a committee, it's a great opportunity for people to get to know you, know your work, know what you stand for, know your brand, and build your reputation. And then it is much easier to find letter writers that you need for those next promotion levels. And we've already talked about collaboration, but these committees really do allow for a lot of opportunity for collaborative work, which can really very, very quickly accelerate your academic output. There are a lot of societies now that have committees that are doing things like webinars. So it's a great way to get invited to speak for a national level meeting. There are committees that will churn out tons of papers on various topics related to that committee's work. It's a fantastic way to dip your toe in the water of learning how to write one of these papers and to also getting a lot of very quality papers that you would never have been able to do on your own out there in a relatively abbreviated time frame. So the collaborative opportunities of this academic society work are absolutely boundless. And then there's my very, very favorite, which is the double and triple dip. When you are putting in so much effort to put together talks like this, or to write curricula, or to mentor people, you should try and make it not be a one off. So you should try and give this talk in 6 different places if you can. Never let a talk go to waste and try and recycle it if you can and use it for multiple things. And I'll give you an example from my own personal experience. So I happen to chair a committee, an education committee, shockingly, which had as one of our goals decided that we were going to try and write very high quality papers on non-interpretive skills and educational topics. Before the pandemic ever hit, we were interested in writing a web-based conferencing paper because it's a very tech savvy society. So, as the chair of the committee, I happened to be allowed to be the lead author for the paper, which was published at the height of the pandemic. So, when Baystate was asking to put papers that are related to COVID on the website, my paper was included in there. And someone approached me to try and put together a lecture on the topic to really get this information out there to people so it could be of use. So I did. And I ended up giving the talk twice for the organization, once for Office of Faculty Affairs and once for the Remote Work Summit. And I'm going to end up recording it for a national webinar, which is going to be broadcast by the same society that we wrote the paper for. So I shared the outcome of this with the journal editor who published the paper, and he shared it with the board members of the society. And guess what that did for my visibility within the organization? Really elevated it. So by that one paper that was written collaboratively with other members of the committee, I got 3 talks and the high visibility from members of the society's board. Talk about a triple dip. So that's my top 5 countdown for things that you should really think about in terms of getting your academic activities out there and how you can align your passions with what you're doing. So, we're going to finish up the talk with looking at a couple of examples of how this all sort of fits together. So, here's an example of someone who is asked to be a reviewer for an academic journal, and that's on the basis of their reputation as being an expert in the field. Clearly, there are benefits to doing this for your own personal development. It will improve your knowledge base, you can improve your critical assessment skills, and you really, frankly, can tremendously improve your writing and research technique by understanding what makes a good paper and what makes a not good paper. And by synthesizing all of that information, it will really improve your own writing technique. So I highly recommend trying to review for at least one journal, possibly two. Don't do the six journals or seven journals that some of us do, because you want to be able to really focus your activities and work within your bandwidth and produce very high quality reviews. And if you produce really high quality reviews, you may win an award as an outstanding reviewer. Again, speaks to your reputation and your brand, and that you're very highly regarded in this respect. And if you do this enough, you may have an opportunity to become a deputy editor for a journal if they think that your work is that outstanding. So just from learning to be a reviewer and doing it well and having your reputation grow, you ultimately can end up at a very high level position within a journal. So now I'm going to take you through a little scenario as we wrap up our talk. And I do not expect any of you to really internalize this. What I want you to do as we're reading through this is to think about how these activities might align with what you're doing in your own personal careers. And then we're going to extract some of the information to show you how it can be used for academic output. So in this scenario, you work 5 clinical days a week. You precept some students and some residents. You're a site supervisor for community outreach. You're doing local interviews with the news on the outreach programs that are coming out of this community outreach program. And maybe you've negotiated with some local food banks for clinic space so that you can see patients in this arena. You're the only provider for food insecurity disorder in Western Massachusetts. And you've gotten grant funding for a study on diversity in healthcare disparity in your patient population. You've also written a peer reviewed publication on the findings of your grant. You're invited to present the study findings at a national meeting. You review articles like we were just talking about for a national journal that's peer reviewed and has a high impact factor. And you attend a national meeting, but you're not necessarily presenting at it. In your everyday work, you also give career guidance, you help to write the rotation curriculum, and you develop lectures and teaching tools. So, how can you use these activities to come up with some outcomes? So, let's look at our clinical resource for community outreach. What can you do with that? So you can convert that into a grand rounds that you can present locally and regionally. Again, this goes to your reputation. So as you present your work, you become known as the expert in this arena. You can then take the information that you've gotten from this grand rounds preparation and turn it into a grant submission. Again, all stuff you're doing every day, but it's just using your time and your activities to take those next steps and to transition it into something that is an academic output. What about the clinical resource for underserved community in food banks? Well, you could turn that into a review paper for a peer refereed journal. And that itself, by submitting it, can actually get you on the list of potential reviewers for a journal, because very often journals will take people who have submitted, particularly if it's a good quality work, and they will and then invite them to become a reviewer for the journal. And that paper may have gotten noticed by somebody on social media when they saw your visual abstract, and that may end up culminating in an invitation for a national meeting presentation. What about being a regional expert on mental health and patients with food insecurity? Well, you can take that experience and develop and implement a presentation of the clinical guidelines and referral patterns at a national meeting. And you may even be able to bring it to the society that you're presenting at on a committee, or meet somebody as you're presenting it at the national meeting who might be interested in publishing that work as a peer reviewed paper or developing it as a policy that can be applied broadly across all people in that society or in that subspecialty arena. How about teaching? What about teaching healthcare disparities to the trainees, which you're already doing? Well, you could take what you're doing as your curriculum development and convert it to a embedded portal curriculum, which is a peer reviewed resource. What if you were to facilitate some small group discussions on counseling patients with food insecurity? How could you leverage that beyond the institution? Well, you could present this as a workshop at a regional or a national meeting, and that might get you invited by attendees at that presentation to speak on the same topic at different institutions. Again, leveraging your reputation. It's work you've already done, you're just doing it in different venues. So, I hope that I've shown you that it is relatively easy to convert these activities to output. And with that, I will end the presentation.